Well, it looks like Emma's growth and development is right on track and everything looks really awesome. So we're going to go ahead and get her vaccines ready if that's okay with you.
Okay, well what does she need?
Today we have her scheduled for the HIB vaccine.
Oh yeah, my friend actually chose not to get that for her baby. Is that bad, or what's your opinion on that?
Would you like us to give you some more information about it so you can make an educated decision?
Yeah,
Okay.
definitely.
Well, HIB, it stands for the Haemophilus influenza type B. So this is a bacterial illness where it's caused by a bacteria that can cause many different types of illnesses. So it can cause meningitis, epiglottitis, pneumonia, arthritis, and cellulitis. It used to cause a lot more illnesses and deaths before the vaccine was invented, but now that we do have that vaccine, the incidence has fallen by 99%, so that's pretty good.
Okay, so like how common is it then?
Well, today in the United States, we see less than 1 per 100,000 people have this disease, so it's actually really good. Like Allison said, it's dropped nearly 99% since the introduction of the vaccine, as the graph shows as well. We see HIB most commonly in children under 5 years of age and then adults older than 65 years of age. And we see it mostly in children under 5 because they've either not yet completed their immunization regimen yet, or their parents have chosen not to have them vaccinated.
So how would she get it, I guess, is what I'm asking.
Okay, so like I said earlier, it's caused by the invasion of a bacteria. And one of the scary things about HIB is a person can contract that bacteria, meaning they have it in their system, and they may not show symptoms. So even if they are an asymptomatic carrier and they're not showing those symptoms, they can still spread that bacteria to other people who are not protected by the vaccine. So HIB is spread from person to person through respiratory droplets. So that means that it can be spread through things like coughing, sneezing, or close contact with a person where like some of the bacteria could be expelled from the lungs out into the air. And the peak age for infection is 6 to 7 months after most children are done with breastfeeding.
Okay. So if she didn't have symptoms, how would I know she had it?
Well, like Allison said, there's a majority of diseases that you can get from the HIB bacteria, one of which is pneumonia. And so if Emma were to contract pneumonia from HIB, you'd see a fever, productive cough, and rapid breathing. One of the most common things we used to see with HIB is meningitis, and that would involve a fever, stiff neck, headache, or vomiting. Epiglottitis, which is an inflammation of your epiglottis in your throat. It keeps food from passing into your airways. The signs of that would be a sore throat, possible drooling, difficulty breathing, and a fever with that as well. An ear infection or otitis media is or would be manifested by an earache or fever. And then arthritis, you'd see redness, swelling, tenderness, stiffness, pain in the affected joints. Cellulitis, that's a skin infection, so you're going to see redness, tenderness, pain in those affected areas, as well as a possible fever.
So how serious are those things?
In general, the outcome for these patients is really good due to the treatment options we have available. However, if you do become infected with HIB, you can experience deafness, convulsions, and intellectual impairments later on. A small percentage of those patients also develop lifelong neurological problems, and fatality rates range anywhere from 4 to 5%.
So how is it treated if she were to get it?
Some of the treatment options we have available are IV antibiotics, depending on the area affected. We also have supportive care, and tracheostomy and intubation is available in cases of severe epiglottitis. Some things that the nurses can watch for in an affected child is an impaired gas exchange, signs of acute pain, and ineffective airway clearance. Some of the nursing interventions we have are for epiglottitis, we're going to maintain an open airway. We'll have suction, trach, and intubation equipment available at the bedside if we need it. For meningitis, we're going to do frequent neurological assessments. For pneumonia, we're going to monitor breath sounds regularly. We're going to continuously monitor oxygen saturation. We can also encourage the patient to get up and walk around. And in all of these forms, we're going to need to gown and glove and put mask on as we enter and exit the room. And we'll also need to do hand hygiene.
Okay. That definitely sounds like something I want to prevent from happening. So how would I go about doing that?
Okay, yeah. Well, like we told you, mainly HIB is spread through direct contact, respiratory droplets, and body fluids. So we know that general hygiene measures like hand washing, things like that, are especially important. But especially that's where the vaccine comes in. It's our best way to prevent HIB-related diseases from coming about. So we also know that preventative antibiotics can be given to you. If your baby had HIB, we would put you on preventative antibiotics as well. So we know that the vaccine, excuse me, today protects infants that are as young as 6 weeks old, but you don't want to get it before they're 6 weeks old because it could prevent the later doses from being as effective as they could be. So your baby's good because she's about 2 months of age, so she's already past that 6-week mark. This vaccine is recommended for all children under the age of 5, and the diseases that usually come about if they hadn't gotten the vaccine usually occur around the age of 2, so that's why that is. There's various forms of the vaccine. There are 2 different options. You could get a 3-dose vaccine or a 4-dose, and if you got the 4-dose, your baby would get doses at the age of 2 months, 4 months, 6 months, and then between 12 and 15 months. And if you got the 3-dose option, you just wouldn't get it at the 6-month mark. So that's the schedule of it. And it's important that you also stay on schedule because you don't want to miss doses. But if that were to happen, you just have to call your doctor and they can give you a catch-up shot. It's not necessary to start the whole doses over again, is basically what I'm saying. So
Okay.
does that sound good?
Yeah, I think I should do it, definitely.
Okay, great. Then we'll go ahead and get that ready for her.
Okay, thanks.